Next up on the number one tee.
Well, hello and welcome back to your virtual tea time. My name is Tori, and today we have Dr. Audra Lance, sports and non-surgical injury specialist, also host of the Mind Your Body podcast, and a referral from my favorite business coach, Tiffany Carter. I'm so glad to have you on. Hi, Audra.
Hi, thank you for having me. I also love Tiffany as well. She's amazing.
She helps guide us in all the right business directions. As long
and control our crazy.
Yeah, as long as I'm willing to ask the questions. Some days I'm like, nope, I'm going to do it myself.
Yep. And then I fail.
Exactly. So tell us a little bit about yourself, what you specialize in, and how you're going to help us today, us as golfers.
I have my own practice in Brentwood, Tennessee, just south of the Nashville. Yeehaw. We really focus on concierge care of getting to the root cause of the injury, not just treating the site of pain. And for golfers, for instance, we see a lot of golfer's elbow, low back stuff, and we're trying to find the source. So sometimes your elbow pain could be from your neck. Mm-hmm. So we love actually figuring that out instead of having you struggle with the pain. And then secondly, or as equal, some people come to us for more performance enhancement and care and prevention of injury, of just minutely dissecting their swing and being able to find all the weak links in the chain and then helping them accelerate and perform at their very best to get the edge.
I love me some performance edge. So can you dive deeper into that? Like, who is that for? Who is that service for? What will it help them with? Like, tell me about it. I'm interested. I am your customer right now.
I love it. So it's for anyone who really wants to get to the next level of their sport. So are you struggling with the acceleration of your swing, or do you need more power? We have some people that just keep grinding their back and getting injured every 3 months, which, by the way, I have a fun statistics for you that I couldn't wait to share. Okay. From some of the research, we're always leading edge of cutting research in like sports and performance sector. And from New Zealand, they had the study that came out that said 41% of amateur golfers get hurt within their first year. 50% of professional golfers, which we have seen, get an injury at some point within a year, which is not that long. So it just shows that you guys are doing a grueling sport that takes a toll on your body, even though people joke around of, oh, you're just in a golf car, having some drinks, having fun.
Yeah. I would imagine that a lot of those players too don't think it's because of golf. Like, right. Because to a new golfer, it might not seem like such a complex swing or fast motion. They probably think football, baseball, tennis, those things are more injury prone than golf. I mean, golf is slow. Golf is, you're just walking and you're just swinging once in a while, so I bet you they're not even thinking it's a golf issue.
Yeah, exactly. But like with your swing, you're dissipating your load throughout all different points of your body. So with the edge, we work with anyone from NFL, NHL, like all the way to professionals, to kids trying to get scholarships to go to college and they want to get on the team or want the scholarship, or maybe are trying to work to be pro and they just want someone as part of their team to go through. And if they're struggling with injuries, like, let's pick out the points of why this keeps happening. Or we've had some people come to us, like I said earlier, of like, let's work on my acceleration. Where do we need to hit? And this is through, we call it game plans of exercises and things you can do for yourself. So I created a program called The Edge where I can own my schedule. I am so slammed, but I really want to help more people. So virtually you can work with me. It's an 8-week program and you get me on demand. We meet once a week. You get customized game plans of how to reach your goal to give yourself that edge.
Okay. Question for you. Is age too old? Meaning like, can you be too old to uninjure yourself? Does there come a certain point where you're at 50, 40, 50, 60, where you have low back pain and there's really just nothing you can do other than, something drastic?
Without knowing the specific case, obviously everyone's a little different, but a generalization line is absolutely not. We've had golfers that are 75 come in and have relief, and they are beating all their friends and winning money out on the golf course and able to travel with their friends to go golfing, to play in the tournaments, and able to live life the way they want to live life.
Okay, so let's get into, I have to ask this question first because it's just my own curiosity, which is, what is golf elbow versus tennis elbow? Like, what are both of them, and how are they different?
Both have to do with inflammation around your elbow and technically tendonitis. So tennis elbow is if you look at your elbow and where your pinky comes up, follow that all the way to your elbow, just a straight line, your lateral epicondylitis. That is where tennis elbow is. Now, looking at your thumb, follow that straight line up more, and it's just like sinking in right there, is medial epicondylitis. And that is golfer's elbow technically. So just different parts. And it could just be within minute millimeters of each other. So that's why, but it's inflammation of the elbow. That sucks.
Is the pain similar, or does it feel different to have tennis? Like, do you know right off the bat if you have one or the other, if you're prone to that?
If you play tennis, you're more likely to get tennis elbow, and golf, golf. But just like poking around and feeling where the sorest point is will give that away. But also going through, like, does it hurt when you bend and straighten or rotate? And just where the swelling is and the most tender is usually your point of reference for medial, without being a doctor, medial epicondylitis or lateral epicondylitis.
So for something to get inflamed, so for your elbow to get inflamed, it has to be aggravated repeatedly. So is it just a part of your swing that's aggravating it? Could it be something else? Whether it's a tennis swing, is that how you would say it? I mean, I'm a tennis player too. Tennis swing. Yeah, I guess that is. Or a golf swing. Like, what's going on to really cause that inflammation?
So first there could be a trauma. So you like hit it against the golf car or hit it against the club, like I would probably do accidentally. And then you're causing direct trauma and inflammation there. The other reason is like repetitive use injury, like you were saying, over and over. So there is something, for some reason, you're not appropriating. I'm not good at English either. Appropriating the load correctly. For some reason, you're not either pushing off your foot, which you got to look at the foot. It can lead all the way down there, or maybe you don't have enough thoracic rotation where your core can really help absorb those forces. Or maybe your hip flexor or low back. You have something going on there where you're not getting the correct rotation or power or speed. So in order to get that range of motion, our body's really smart, and it's maybe extending your elbow a little bit further than it needs to over and over and over again to be able to do what you want the swing to do, causing repetitive motion, repetitive trauma. And then that slowly builds up more inflammation, pain, where your body's like, whoa. We need to take a second and heal this because we can't do anymore.
Okay. So let's talk about recovery then. What's the process like? How long would you have to take off from playing golf? And do you have to go to, tell us how to recover from that injury?
And it depends like where you're at in the injury. Did this just happen yesterday, or have you been holding on to this for 8 months where it's kind of set into almost like a chronic thing that you're...
I think we can assume all these injuries we're holding on to for a while. Because, even as women, we want to think that we can figure it all out on our own, and like going to the doctor is no fun. So we've been dealing with it for quite a bit. I'm really excited to tell you, as a doctor who treats people, I really don't want to take you out of your sport unless we have to. So I want you to keep playing, ideally. So depending on the injury, but we may need to modify. So instead of playing 18 holes, maybe you just go to the driving range and do 15 minutes of swings. Like, we might have to modify in that aspect of your sport, but we're trying to find essentially a movement for you to have ownership and take control of this yourself. So we go through and evaluate, trying to help you find a movement that will be like your Tylenol, I call it, what people would normally pop for Advil. Why don't you do this movement? And then depending what other tissues are connected, because we never just focus on the elbow. We need to look at that shoulder. We need to look at your thoracic rotation, maybe your neck, and figure out from there some more things, either exercise wise, soft tissue wise, you can do yourself. And even more importantly, we're going to look at your breathing. So from there, it's just
how much control of this do you want of yourself? And how much, like, if I'm giving you 200%, are you going to give me 100% back? Like, that's going to heal you faster versus just, I forgot. I don't want to do it, but I want to go out and play. I totally get that. I'm that person too, which is why, like, we try not to overwhelm. We try to find the specific exercise for you to do that.
Is there a brace that you can wear that will at least help at all? Like, do people wear braces on their elbow at all, or is that not a thing?
Usually in that case for our golfers, we'll show them how to tape it themselves.
Oh, so
that
like
provides a little bit more range of motion.
Yeah.
Yep. If you're a bracing set, which obviously there's an exception for everything. Don't take this as 100%.
Yep.
But with a brace, sometimes you're limiting motion so much, you're causing injury at your wrist or your shoulder because you're then compensating way too much.
So for me, when I think of lower back, I go directly to hips. Like almost everything comes out of the hips. If you have lower back pain, it most likely is tight hips. Is that true? What can we do to help not only hip pain, but lower back pain?
Also, that could be chicken before the egg, because like hip pain can cause lower back pain and lower back pain can cause hip pain.
Yeah. So they're married. Yeah.
Yep. Because sometimes it's a referral from your low back that's causing a neurological tightness in your hips. Or a lot of common things that we see is everyone's like, I have tight hamstrings. My hamstrings are just so tight, no matter how much I stretch them. And to me, that's ding, ding, ding right away. Oh, we need to look at the whole chain. There might be the brain protecting itself from getting injured and just tightening up your hamstrings, that it's not even muscular, it's neurological, which is a semi mind-blowing concept. So we need to look up the chain where that source is coming from to give you an exercise or breathing or something to calm down whatever's pissed off in order for your brain to be like, okay, we'll release your hamstrings to move.
At what point do you really need to go to a golf professional to make sure you're not to help your swing? I mean, it seems like, especially for the elbow pain and probably for the lower back too, there can be something going on with your swing that can be fixed that will help.
I kind of tell people the common rule that I use: 3 strikes, you're out. If you've had 3 different injuries that, you know, either they come and go, or 3 different things of like, wow, this has hindered my golf game and not allowed me to practice, you need to start getting stuff evaluated. Because the more that you have that build up, you're compensating somewhere, doing something, and it would be way easier and cheaper. And you would be on the golf course more if you just allow someone to help you.
Exactly. I agree. At what point do you think it's hip replacement?
Ooh, well, first you really have to screen that it's not coming from your low back, because many times the hip is coming from the low back. I think in all aspects, when all conservative care routes have been exhausted, I always start from least invasive to most invasive. And then you get 3 opinions from there of different surgeons. Because even if they're all really incredible surgeons, we all see something different as doctors, like whether it's a movement screen and they're looking at your MRI, CT, all the things. You want to get 3 different opinions and go with your gut of who you vibe with. I feel like that's not talked about enough in the medical world. Not everyone's for you. You're not for everyone. You need to go with people that you feel good with and trust.
So taking golf out of the equation, let's talk about lower back pain or discomfort. Is there something that is most the common thread with lower back pain, that if you just take sports out of it, is it just core strength? Is it how you sleep at night? Is there anything that's really common that we can fix that we might be doing that may be causing that lower back pain?
As crazy as it is, breathing.
Okay.
And I know that sounds as boring as a rash, but it is
boring as a rash.
It is so critical that most of us are right now. Like, can you even feel where if your breath is going down to your hip flexors as you breathe?
Ever since you just said breathing, I have paid attention to my breathing, but I don't think I've paid attention to my breathing in a long time.
I know I catch myself when I get super excited. Like, I noticed on this podcast, I'm so pumped to talk to y'all, but I'm like, oh my gosh, you're holding your breath. Like, we are all up here, the chronic neck pain, the shoulder tightness, your traps, headache, like everyone's breathing up here and using all this. And we're not even getting into our core. You're not even accessing the correct core muscles to stabilize your back, which if you can breathe correctly, you're not going to have low back pain overall because you're utilizing those internal and external obliques, your pelvic floor, your hip flexors. It's all connected, which is why I created like a freebie for everyone to help them because I'm really passionate about this at mytrainingroom.co, Breathe Out Attention. There's 3 free audio series. 1 is before you go to sleep. It's also really relaxing. 2 is like if you're sitting at work or throughout the day, it just gives you a minute and I coach you through of how to breathe. And the 3rd one's when you're traveling. So 3 instances where you get me in your ear telling you exactly what to do. You get to relax and you get to release your tension in like a minute.
How long? In a minute? That's what I was going to ask, how long it is.
Like a minute to 90 seconds, depending how long I go in each one of them. And then from there, once you start getting it in everyday scenarios like that, of just even laying there, then you can slowly incorporate it into sitting and then into your game.
Yeah. So which one of those 3, probably not the sleeping one or the one right before bed, but which one of those 3 would work best out on the golf course?
Probably the one where like we're talking about like at work when you're sitting there or standing there because it's made for sitting or standing desks.
Is it potentially something you can listen to kind of, multiple times off the golf course, but then get the idea of it and work on it on the golf course?
Absolutely. Absolutely. It's plug and play.
Yeah. Because our favorite golf instructor, Justin Klimbala, always says tension does no good for the golf game. Like tension is the worst thing for a golf swing, a golf game, in all scenarios. So doing this 1 minute exercise, breathing exercise might really help out in those nerve-wracking situations or just the times where you have a bad golf hole and you need a couple minutes to calm down.
And even a tip, like just talking that if you were my patient right now, I would say, hey, based on like, I agree with him 1,000% based on both these things. Right before you swing and you're standing there, inhale through your nose, exhale through your nose, then go. Because you're going to release all that tension. And it's really quick and easy.
Why through your nose both times? Or like, why isn't it out through your mouth?
Because all this cutting research in the past like 6 years is really focusing on nasal breathing. And when you're nasal breathing, you're able to access your diaphragm and pelvic floor more correctly. So sit here first, try to take a breath through your nose and think of really filling up and then exhale through your mouth. And then again, in through your nose. Really feel if you listen to my podcast, my signature thing is breathe into your butthole. So try to breathe all the way down there.
Okay. You just sprung that on me. Okay. Let me start over.
In all the way down. And then exhale through your nose. You feel like you can control those muscles a little bit better. I know this is only your first time doing it, but once you get it, there is quite a difference. So you're using the diaphragm and pelvic floor together in synergy versus exhale, you're using more chest.
Okay, that's interesting. I'm playing in a pretty big tournament in 1 week, and I might test this out for sure.
Oh, you'll have to let me know.
I definitely am breathing through the nose or breathing through the nose and out through the mouth. Like I did breath work with Sam Skelly. I did her facilitator training long ago. And so there was a period of my life where I did breath work regularly. I loved it, but it was a lot of in through the nose, out through the mouth. So it's just interesting that do the nasal. I love it. I love it. Okay. Let's get back on track. How about thoracic spine rotation? And can you tell us what the thoracic spine is?
The thoracic spine is essentially that area between your shoulder blades, and it extends a little bit lower. So your neck muscles come down and they connect like under the base of your neck in the middle of your shoulder blades. And then your thoracic spine is like top of your shoulder blades all the way down to your mid back. That section in there. And for a lot of us that sit like this as I'm talking, we are just in that forward hunched over position and we get short chest muscles and everything gets tight and we can't open that up. And especially for golf, you need to be able to open that up all the way to be able to swing. And
do people injure? Does an injury to your thoracic spine, does that more look like a shoulder injury or lower back? It doesn't seem like something that someone says a lot?
I mean, it can present in a lot of different ways. Sometimes people feel like their ribs are quote unquote out, even though we can't have bones be out. You'll be in the ER, but they're just reduced movement.
This is funny because I've had some chiropractors tell me I have a rib out. So you're saying that is a bunch of bullshit.
I mean, people just use it as a term, but it actually, like, your bones aren't out of place. And if they are, they're broken, or you're like in the ER. There's just all an adjustment is just restoring a few millimeters of motion to your spine so that you can move easier or the muscle tension decreases. So yeah, all you're doing with the rib is it's just like has a little bit of glue on it for some reason, whether that muscle spasming around it, the fascia's intertwined, like there's a bunch of it, but you're just lightly adding some pressure to restore that motion in it 2 millimeters. So that might present like that, or like a catch in like breathing, like, oh, my side all the time, it won't go away. It could be like a shoulder blade thing.
Yeah.
It just depends. Sometimes there is like little disc issues where it's just like this burning little pain in your thoracic spine. Those aren't like crazy common though.
Okay. How about the neck? What's going on with our neck?
Well, most everyone, we are staring at our phones, texting and scrolling through Instagram, myself included, way too much.
Yep.
So that forward position, you're just putting your neck all the time in a more vulnerable position. And when it's angry, you can feel shoulder blade pain all the way down to your hand. You can feel it in your elbow. You can feel it in your pec. You can have headaches. You can have jaw pain. Everything's connected, just like the song, head, shoulders, knees, and toes. So it's really, that's why I love my job. It's a puzzle, and you and 3 other people could come in with the exact same thing, and they may all be different reasons why or what's going on.
Is muscle strength training a big part of this?
I'm sure everyone's read the studies. Like, strength training is so important, especially as we're aging. Like, if you're over 30 and not doing some sort of strength training and loading, because what we need to do in order to prevent like bone deterioration and muscle deterioration, we need to load that joint and use all those muscles correctly. And it doesn't have to be tons of weights. Like, it can be air squats, just sit in a chair, get up 10 times. Like, you can do resistance body weight. You don't have to be in the gym crushing it every day.
How about yoga and, stretching, mobility training? How important is that?
I definitely think it's a component. It depends also, like, my recommendations are if you have an injury going on or not, because some of those yoga positions put you in a more vulnerable position until we are able to correct. Then we just need to modify a little bit. But I also think yoga stretching offers another component that we talk about a lot, is mindset, and it's relaxing. And we all, like you were saying with the tension thing, if you can't turn it off, relax your mind a little bit, and just like slow down instead of always power, strength, you're not gonna get over that boundary as easy.
Okay. So you wanted me to bring up to looking at the feet.
With golfers, I think that is something that I have so much fun with when I treat them, that a lot of people haven't even talked to them about, is taking off their shoes and socks, looking at their feet, looking at their golf shoes, like what pattern are you wearing into them? Where are you pushing off? And combine it with the full exam. And can you even activate your foot, or is it just like a flipper coming along with you? Like, should you be swimming?
Oh my God. So you're able to have someone take off their golf shoe, show it to you in the office, and you can see what's going on with their, wow.
Yeah. We go through a few tests. Like, I make you test, and then I get to give you an F.
You should be flipping. Change sport immediately.
You're like a mermaid. What are you doing on land?
So what does that tell you though, when they're just flipping? What does that mean? How can you help?
That your brain is just not fully utilizing every muscle and correct activation pattern that you are able to do. Like, if you can start feeling your feet, it just naturally has the whole chain get back in order or get back in place to activate correctly. It's amazing. And if you can push through your foot, you're going to be able to have that sensation all the way down, that your body will be less likely to put you in a pattern or a position where you would get injured. Okay. And if you can feel your feet, you'll create more power, more speed, more explosion.
Yeah. Yeah. I can see that.
without less torque on your back and your hips.
Mm-hmm. Okay. So let's say I'm 40 right now and I don't have any chronic pain, knock on wood. I mean, I feel relatively good other than waking up in the morning and maybe being a little stiff for a while. How can I keep that going as long as possible?
Well, movement heals.
Yeah.
A body in motion stays in motion. So I think just adding all the components of movement, but recovery and rest, of like relaxing and doing some of that breathing and being able to slow down and turn it off. And then mindset, like of just, you got this, you're going to keep going, set yourself. If you're one of those people that likes to crush goals, set some goals for yourself, or even just, I like maintaining this. Okay. So we're going to do 3 times a week of on the golf course, and then 1 day a week recovery, 1 day a week strength training, and then 1 day a week just walking. Like that is so therapeutic in itself.
And at what point do you see a doctor over some pain?
I like to err on the safe side. If you've had it for more than 3 weeks and it's not going away or budging at all, I'd say 10 days to 3 weeks is when you need to start seeing someone.
Yeah. Okay.
There's too much out there that you just want to make sure. And most likely it's not, but.
Okay. Where can all the listeners find you, find everything good going on in your world over there? I love this.
Yes. Well, please come say hi on Instagram at Dr. Audra Lance, and there'll be some more crazy breathe in your butthole. You can listen to the podcast, Mind Your Body. It's on all major platforms. And then head over to mytrainingroom.co, and that has like the Edge application. It has some freebies on there, and then some game plans if you're struggling with any of those injuries.
I would be remiss to not ask you, have you gotten out on the golf course yet?
Can I tell you my one golf story? Well, I have a lot of them, but one of my favorites. So I was at the driving range with some friends. This is a while ago, but I really have wanted to play golf, and I'm hitting the golf ball, sometimes whiffing, sometimes hitting it. And I hit the ball and I'm like, where'd it go? And there was metal dividers in between. It hit the metal divider, came up, hit me in the mouth, and I was bleeding.
Oh,
yes.
Geez.
Oh, so I need some more practice. I've been at Top Golf since then, and we're getting there. But yes, I have been on the course. It was probably a while ago, the last time, but it is something I love. And so many people do. It's so social. It's relaxing. It's a workout. It's so many things combined. It's, I think, one of the best things you can do for yourself and forever, like not just in your 20s. It's for life.
And that's why it's such an incredible sport that you really don't want to have these injuries taking you away from it, because you really can play it forever, your entire life. But if your hip is killing you and your back is killing you, I just watch so many of my friends, or knee even, that they wait so long to just go get some outside help or get it taken care of.
Yeah.
Any advice for the woman listening that does have that chronic pain and they're just ignoring it at this point?
Well, there's help out there. It might not be the first person you go to, but there are so many of us that want to help you and want you to live your best life, like move better, feel better, live better, and just keep trying. Don't give up hope. It is not just your thing that you have to live with. You can get some relief.
Well, Audra, thank you for being on today. I appreciate it. All of her contact information, how you can find her on social, links to her podcast is on the show notes. And
thank you so much for having me.
My pleasure. Thank you for being on, and we will talk soon.